Hello everyone, welcome back to my YouTube video channel. Today I have maybe 15 minutes. I want to present to you guys a very short presentation. This presentation is for the patient, those of you watching on YouTube channel and want to know what type of role that the dentist can play in your life. I want to do a quick presentation, so let's jump right in. The role of the dentist after the pandemic is really significantly important. And I want to share the slide so I can go ahead and um, uh, share this slide with you guys, okay? So, okay, guys, so the role of the of dentists after pandemic, especially a general dentist, what are the role of the dentist? Um, I want to just today I just want to focus on 6 things. During the pandemic and after the pandemic, we have treated hundreds of dental emergency cases, and I want to touch up about that. I'm also going to touch up about the after pandemic. There is a lot of patients need to get back on their normal oral health. The teeth aren't ready for a routine cleaning. There's a lot of work for dentists have to be done. And then the third thing I want to talk about is uh, the at a dentist we identify potential risks of undiagnosed medical and dental issue in your mouth as well as your body. We identify it and will help you to guide you to where you can go. um, Fourth thing is we at the family dentist we uh, collaborate with the dental specialist, and also medical doctor team to improve your overall body health. The fifth thing I want to touch on is our role is we can educate you and give you the benefit of having a healthy teeth in the mouth. The sixth thing I want to touch up on how the dentist can encourage and support patient to see their primary doctor, specialist, or subspecialist for their care because there is problem after pandemic. So let me just touch up on the emergency things. So at the dentist, family dentist, we treat hundreds of emergency case during the pandemic and after pandemic. What happened is because of the concerning of the COVID exposed, the patient don't show up and they wait so long, and after 2-3 years, the teeth become very, very bad. I see a lot of teeth need to be extracted or require deep cleaning, and also some acute facial swollen teeth need to be either extracted or need to have root canal therapy. And the cost of the reason I talk about emergency care is because the cost of uh, emergency dental treatment and invasive dental treatment is a lot more expensive than the preventative procedure. So we have to, at a dentist, we encourage patients to get back to their routine, to their dentist routine maintenance to avoid emergency dental care, which costs more money and very invasive procedure. This case, for example, a patient have the brush, it look good, but there's an upset of the brush here, and there's big infection of the submandibular gland down here. And this case, the patient had to go to a hospital after antibiotic of IV intravenous uh, intravenous antibiotic. Uh, Patients swollen going down, and the patient had to see a dentist and get their retreat root canal or extract this tooth to avoid a life-threatening situation. So it is important to see your dentist early stage before it get really worse. Second thing I want to talk about is helping patients to get back to their normal health, because a lot of time, when I mentioned to you before, because of the 2-year pandemic. A patient come back with neglect dental oral hygiene. They stay home, they eat a lot more, they eat more frequently, they gain in weight, they have gum infection, deep pocket, more dental caries, they eat more sugar, many the problem, such for example, broken bridge, broken denture, and so many things like that. And it's very important for us to help the patient to get back on their feet with normal oral health care, oral health, otherwise become very bad. One of the things I wanted to touch on is uh, um, the P. gingivalis is the bacteria that very commonly occur inside patient mouth. Everybody, 25% of population have this P. gingivalis bacteria. But the interesting thing that I want to point out is that 79% of patients who have uh, periodontal disease have P. gingivalis, 79%. So majority of patients who have periodontitis, which is a gum disease caused by this bacteria. And the interesting I want to talk about is on May of this year, March of this year, early March this year, I have a conversation with Dr. Edward Ziegler, and he will presenting to us about the Keystone Bio is a bio company, a bioceutical company, study the therapy of how we can treat gum disease patient and actually helping out all the medical problems. So as you look at the P. gingivalis, you can see that this particular bacteria have very strange looking anatomy. A lot of hair grow outside. It seems to be very prominent in gum disease patient, but it's also very prominent in these Alzheimer's disease. So these are the list of the medical condition that related to the P. gingivalis. For example, vascular disease like scoliosis, stroke, minor heart attack, all of those, or cancer, oral esophagus cancer, pancreatic cancer, Alzheimer's disease, Parkinson's disease, cardiometabolic syndrome disease, diabetic, insulin resistant, arthritis, rheumatoid arthritis, blood disorder, renal disease, fatty liver disease, non-alcoholic hepatitis disease, allergy, asthma, macular degeneration, cerebral abdominal aneurysm, regenerate stem cell destruction, implantitis, periodontal disease, bone loss. These are commonly medical dental condition that related to this bacteria, the P. gingivalis bacteria. So one of the reasons I wanted to give you an update, because I want you to have a chance to understand how this bacteria in your mouth that can really contribute to many medical problems for our health that you should be aware of. For example, this bacteria have produce a vehicle, the protein that go around the bloodstream and go to the blood-brain barrier and disrupt the brain barrier, and it causes the damaging of the brain cell, which definitely cause Alzheimer's disease. So Keystone Bio is a pharmaceutical company that are working really hard to find a solution for P. gingivalis treatment that would help not only periodontal disease patient, but also gum disease patient, but also many other medical problem, and prominently they would focus on Alzheimer's disease patient. Now the P. gingivalis also, as you can see the picture here, is also is a mediator for mediator for the endothelium cell that become promote for endothelium dysfunction and vascular muscle, smooth muscle calcification. It's increased vascular permeability and therefore promote cardiovascular disease. So you can see the breakdown of the vascular system and the destruction due to Purkinje valence. So very important to be aware that we have to, at a dentist, we can help you to minimize the bacteria in your mouth, helping not only reduce the risk of gum disease, but also help you prevent cardiovascular disease. So what I mentioned to you about Keystone Biotechnology that form and collaborate by medical scientists, medical doctors, scientists, and dentists who working very hard to find a vaccine and as well as the therapy in the mouth for to treat the gum disease as well as Alzheimer disease. And I'm drawing, seeing a picture of those elderly people having the loss of memory. So I want to go back to the third or fourth thing is we can identify, diagnose medical and dental issues such as I mentioned to you about uncontrolled undiagnosed diabetic type 2, um, uh, and then also other conditions like obesity, obstructive sleep apnea, depression, suicidal thought, bipolar, high blood pressure. We can identify and recommend you to see your medical doctor. We can collaborate with specialists, dental specialists, for example, treating your gum with gum specialist, endodontist specialist to treat your gum, root canal specialist, or surgeon to take care of your invasive surgical procedure, and also a medical specialist. We can collaborate them and to treat your medical problem. And so we also can educate you how to take care of your teeth because treating routine care really save your money from going to advanced procedure. And my staff calling me, I just want to say, summarize that it's important. Oral cancer is not just something new. It's been in the literature. You can have gum cancer or tongue cancer. And if I see the patient with overweight and gum disease, I would get the HbA1c blood test for diagnosing diabetic, and then I can talk about the number run through the mouth really quickly. I can show you that gum with a nice teeth, but your gum puffy like this is bleeding gum. It's not good. Same thing here. When you see the corrosion of your teeth, you have the gastric esophagus reflux disease. When you have a gum puffy like this, you have gingivitis problem. And when you come with teeth grinding, you have possible sleep obstruction anemia. So again, this is crowded teeth with plaque buildup, cannot clean. You got to get deep cleaning and see the orthodontist. Broken tooth like this, no pain doesn't mean it's okay. Infection can travel to your other part. And we also see, trauma and infection tooth and implant fail. It's very, very important, guy, to because my staff calling me, so I want to stop quickly to let you know that take care of your teeth early. Prevention is better than extension of treatment. Thank you for watching and have a great day. Bye bye.